Peace be upon you. Welcome. The screen is a bit blurry, so welcome again. I know people are a little late to join, and maybe not many people are online right now. It's 8:20 a.m. Egypt time, so maybe no one is ready yet. We're going in as a surprise, so I'll start right away. Those who missed the broadcast or part of it can catch up. If anyone has questions, we'll answer them, God willing. Now, let's continue our journey and tour of medical research, which we're used to. We have a very important study published in a very large journal called Nutrition Research Reviews. It's about anti-aging natural supplements, which are natural supplements that combat aging. It will focus on the most important ones, which are the main things that promote a healthy life. In the abstract of the research, it says that this article explores and gathers. This is a reference article, meaning it discusses the effects of for natural compounds omega-3, coenzyme Q10, gingerol, and curcumin on the aging process. It starts with omega-3 and talks about it in a very interesting way, making you think you should take an omega-3 capsule every day or eat 2 servings of fish rich in omega-3 every week. It explains that omega-3 contains 2 types of fatty acids. It helps reduce inflammation, which is in addition to lowering the risk of heart disease and stroke. It treats, prevents, or fights certain types of cancer. It fights rheumatoid arthritis, which is something different from rheumatism, something a bit more severe. It helps with depression to some extent. It also helps with asthma. The article states that the omega-3 fatty acids found in fish oil are essential, also, for brain health. All of this is written in this research. It helps maintain cognitive functions, meaning it helps one focus a little more as they get older. Like in our case, preventing senility and reducing forgetfulness. It's a beneficial process for health. The risk of dementia. Everyone is susceptible to this. As people get older, their ability to memorize and recall information decreases. This helps reduce that. Now, what about plant sources? Are there plant sources? I know that fish oil is omega-3, but I didn't know it was found in plants. This research says there are plant sources, for example, rapeseed oil. I don't know about these. If anyone knows, please tell me. Soybeans, the Chinese love them. Flaxseed oil. Flaxseed oil is very popular in Egypt. And harissa oil, it's essential here. Some people love to use it in the morning, or have it for breakfast with fava beans. Fava beans are a staple in Egyptian cuisine. Peace be upon you. Welcome, Professor Luminari 126. Welcome, good morning. Noor. Good morning, everyone. I know I'm coming at an odd time, but because of time constraints and work, the broadcast is being repeated anyway, and anyone who hears it will be listening. Soybeans, flaxseed oil, and chili oil are good. A friend of mine told me he found his cholesterol and bad cholesterol were high. So he got olive oil and chili oil, which is flaxseed oil. He's using this on flax seeds. There are also walnuts, which are a bit expensive. In addition, there are dark green leafy vegetables. This is the first time I've heard about this, guys. These green things contain vitamin A and magnesium. but they also contain things like folic acid. They also contain vitamin B3, but this is the first time I've heard that it's found in dark green leafy vegetables like arugula, radishes, and the things we have here, and chia seeds. And walnuts are good too. Of course, animal-based foods, like fish and fish oil, contain DHA and diabetes. Immunodeficiency acid, which is omega-3 oil. It consists of two things, A1C and DHA. Their scientific names are docosahexaenoic acid DHA and icosapentenoic acid EPA. These are rather complicated names. Anyway, they are two components, and their proportions vary. Showing the human body's needs from birth. Until 6 months, a boy needs half a gram, and a girl needs half a gram. I know that for those with children who have developmental delays, they should get them omega-3 supplements. These are chewable, not capsules like the ones we swallow. From 7 to 12 months, those with children need half a gram. From 1 to 3 years, they need a little more, 0.7 grams. That's almost like a capsule, but these are chewable. From 4 to 8 years, they need 0.9 grams, both boys and girls. So, this means we're getting closer. At this age, they might not be able to swallow it, but between 14 and 18 years old, it's 1.6 grams for boys and 1.1 grams for girls. And now it's starting to include pregnancy. If there's a pregnancy, meaning 18 years old and pregnant meaning she got married very early, she takes 1.4 grams, so instead of 1.1 grams for women, she increases it a bit. And for breastfeeding mothers, it's 1.3 grams. From 19 to 50 years old, most of our viewers in this age group should take 1.6 grams for men and 1.1 grams for women. From 51 years old onwards, men should take 1.6 grams, which is about 1.5 capsules, and women should take 1.1 grams, which is about 1 capsule. This is the normal, healthy daily requirement. They can take capsules, get them from fish, the seeds we mentioned, and flaxseed oil. The important thing is that this is the normal intake. The American Heart Association recommends taking omega-3 supplements, which contain specific ingredients, for people with coronary heart disease or heart failure, people with heart problems, should take 4 grams for omega-3 capsules or eat fish. This also applies to people with high triglyceride levels who have heart problems or heart failure. Fish oil, folks, the American Heart Association recommends 4 capsules a day, which is a very high amount. They say that levels of docosahexaenoic acid DHA in red blood cells are inversely related to the risk of Alzheimer's and dementia. So, the higher your levels of these omega-3 fatty acids, especially DHA, the lower your risk of developing Alzheimer's and dementia. This is something foreign countries are particularly interested in because Alzheimer's is much more prevalent in Arab countries. They say that it has been proven that taking fish oil supplements experiments conducted on female mice with autoimmune disorders improves their immunity by 40%. I even did a segment about people with acne, and fish oil was a treatment for acne on its own. This means it boosts their immunity against microbes. The thing that causes acne, well, it also tells you that many heart problems have been alleviated. Again, they've done this in experiments using fish oil rich in omega-3 fatty acids in old mice. Old mice, like us, have heart problems and high blood pressure. They say that omega-3 reduces these issues, including ventricular hypertrophy. They have enlarged heart muscles, so instead of taking digoxin and lanoxine, they can take these things. Of course, we're not saying to stop taking medication. We're just saying to take these things and see how much medication we need. Maybe we won't need much. Studies conducted in 2013 showed a decrease in the overall mortality rate, especially deaths from cardiovascular disease, in people with higher levels of polyunsaturated fatty acids. Omega-3 in the plasma. Those with omega-3 levels had lower mortality rates. Is great news about omega-3. It makes you want to go straight to the pharmacy and buy a box of omega-3 the moment you leave work. It's available. So we're not going to mention any specific company. This is one of 4 nutritional supplements. Now let's talk about the second one, coenzyme Q10. I made an old episode about it and re-aired it a few days ago. You can go back and listen to it. About the benefits of coenzyme Q10. So, what it says is that coenzyme Q10 is extremely important, and we focused on it in the episode for people taking statins medications to lower blood cholesterol. They experience problems from statins, such as muscle pain, especially in those taking high doses or for extended periods, which can lead to muscle fat accumulation. The levels are very high. The numbers are terrible. He's told to take 20 or 40 milligrams, the high dose, and stick to it for 2 or 3 months. Then he notices his legs are hurt. What happens? Problems arise that lead to damage to the muscle fibers themselves. This can affect the muscles and also the kidneys because there's protein breakdown, leading to kidney problems. The solution is coenzyme Q10. Coenzyme Q10 is the main regulatory step. It reduces synthesis. Statins also reduce the natural coenzyme Q10 in your body. This is a natural substance, by the way, present in our bodies, but it decreases with age. Those who take statins experience these muscle problems, which cause the solution isn't to stop taking statins because cholesterol is high and there's a risk of heart problems, high blood pressure. Something that reduces this. FQ10 reduces it. With age, it's essential to obtain it through diet. So, where can you find natural coenzyme Q10? It's available in pharmacies as a supplement. It's also found in animal meats, such as fish, red meat, and vegetables. Examples of meats include lamb and, of course, pork, which we won't discuss here, chicken, beef, and fish. So, if you eat fish, you're getting to things. And coenzyme Q10. Fish oil with him, in addition to broccoli, spinach, peas, cauliflower, and fruits like oranges, strawberries, and apples. It's found in so many things. You can also find it in grains like rye and wheat. What's rye? I don't know. Rye. Rye, whoever knows, please tell me in the comments. I know. Wheat. It's worth mentioning that animal parts like chicken thighs and chicken drumsticks, No, the drumsticks of chickens are also good. For those who eat chicken, some people, may God have mercy on them, chicken because it contains hormones and is saturated with them. And this is true, chickens are saturated with hormones because they are given hormones. So, of course, for people who raise chickens, the best thing ever. A drumstick takes about 6 months to grow, but this is the best found in chicken and in herring. For people who like herring or salmon, well, salmon ... the speckled and the heart love to buy the heart, and all of these are excellent sources of coenzyme Q10. Okay, but I don't have these things, or I don't like my food, or Dr. Dia told me not to eat chicken because it contains hormones and that this is harmful. True, and so we don't want to take these things. He also says that a decrease in Q10 levels is linked to aging. Okay, and this leads to what? It's an anti-inflammatory that appears with age, so it decreases a lot, and consequently, inflammation increases, and this is what leads to aging. He says that as soon as it starts to decrease, like a substance called interleukin-6, which makes you age faster, and a substance called tumor necrosis factor. That's also its name, but it's a very big problem. So, what does he say it's related to? Heart diseases, and this is the important thing that all cardiologists work on. Cardiovascular diseases. Blood problems are very common in anyone after 40 or 45 years of age, especially if they smoke cigarettes. They get high blood pressure, heart problems, heart failure, and so on. They found that their Q10 level is very low in the heart muscle. Therefore, any cardiologist who prescribes medication will add coenzyme Q. High dose. We will look at the doses now. It has been proven that treatment with coenzyme Q10 improves the contraction of the heart muscle and improves the level of harmful fats in the blood. This contributes very significantly to heart treatments, so they always prescribe it. Okay, so they're saying that Q10 levels are positively correlated with IQ, meaning someone with higher Q10 levels tends to have higher IQs. People with children might get Q10 supplements if their academic performance is poor. The level of the Q10 enzyme in the pancreas and adrenal glands is highest when a child is around 1 year old. This means that when a child reaches 1 year old, Q10 levels are at their peak. It's the most powerful enzyme in the brain, heart, and lungs, reaching its highest level around age 20. This means it increases in the pancreas and adrenal glands until around age 20, then stabilizes, and then continues to increase in the heart, lungs, and the rest of the body until your body until you reach 20. However, after reaching this peak around age 20, it starts to decline. It begins to decrease over time. So, someone like those in might not find Q10 in their body. His body will be completely depleted. Little bit. Other studies tell you that Q10 levels decrease in the brain as we age, and they also decrease in the heart. This is normal up to the age of 80. There you have it. The percentage at age 80, okay, less than 50% remains. 50% for someone who's 80 years old, or maybe a little more. Studies have shown that coenzyme Q10 is a safe and effective treatment for diseases in humans. There's absolutely no problem with it. So, where is it? Go to the capsules called Q10 supplement or coenzyme Q10. Q10 is available. Many companies produce it in every country, in every pharmacy. So there's no problem with it. That's another one the research is talking about. Pay attention, everyone. Get bored with this long live stream. Don't wait, because there are some things coming up about diabetes coming up in this episode. The third one is ginger. Okay, we talked about this in the previous live stream, so we'll quickly say that many studies have proven that ginger is beneficial to health. It reduces oxidative stress and is a vital element in treating many diseases. It has been used for centuries and contains many substances and active ingredients. It has antibacterial, anti-inflammatory, anti-cancer, and anti-diabetic effects. Okay, it's a stomach protectant and a nerve protectant. Okay, it reduces the symptoms of some diseases, like ulcerative colitis. There was also research on this before. If anyone was following our live stream, there was a with ulcerative colitis. Go back and watch it. I'm talking about not irritable bowel syndrome. Ulcerative colitis is more severe, and its treatments are very expensive. It helps with urinary tract infections. If you have urinary tract problems, then you have ginger, when combined with medications, helps with psoriasis, lupus, rheumatoid arthritis, and even cancer. That's great. The fourth and final one in this research is curcumin. We've also encountered turmeric before in a study, and we'll quickly summarize what it states that curcumin is a powerful and effective anti-aging agent. Readily available, safe, and completely free of problems. It's rich in polyphenols, which are phenolic compounds. It's extracted from the long turmeric plant, which comes from India. The problem is its poor absorption by intestinal cells, no matter how much curcumin you take. It's only absorbed about 1 in a million, so there are many methods to increase absorption. One method is to take curcumin with black pepper. Black pepper contains curcumin. The advice is to take a small spoonful of curcumin with half a spoonful of black pepper or a quarter pepper in order to increase its absorption. This was the first attempt in pharmaceutical attempts in. You find that they tell you that the capsule is treated in a certain way with the curcumin itself, something called nano and something called liposome, in order to increase the absorption of this curcumin and how it enters the body. In a good way, it tells you that with age, a low-grade chronic inflammation occurs, and this is what contributes to aging. Curcumin is an anti-aging agent that reduces the symptoms of age-related diseases like atherosclerosis, diabetes, and cancer. All these are age-related diseases. Also, it tells you that older people are more susceptible to cancer than younger people. Cancer is always on the rise in older people. Yes, it happens to younger people, but its incidence increases with age. Half of the cancers diagnosed in older people are prostate cancer in men, and lung and colon cancers account for half of all cancer cases. Breast, colon, lung, and stomach cancers make up 48%. It has been proven that curcumin protects against tumor formation by reducing toxicity, stimulating cancer cell death, and inhibiting cancer spread through its anti-angiogenic properties. Many studies have shown that if you are taking cancer medications, you cannot stop taking them. You must take curcumin with them. Curcumin, you get curcumin itself in capsule form, which is good. It activates antioxidant enzymes. Okay. Chronic inflammation, fine. They tried it on yeast, mice, and all these living organisms. It affects autophagy. Go back to a previous episode where we explained what autophagy is. It stimulates and activates the mitochondria, leading to improved cell survival. Now, clinical trials conducted on humans. The same curcumin trials on humans show a positive effect of curcumin on age-related disorders, specifically osteoarthritis. Osteoarthritis is very important. Anyone with arthritis should take medication, but they should also take curcumin. This is a chronic condition affecting the joints and is closely linked to chronic inflammation. Our joints always get tired with age, so they said turmeric has anti-inflammatory effects on arthritis in humans with osteoarthritis and rheumatoid arthritis, which is even more severe. They randomly divided to groups of 40 participants each, including people with knee joints. Some people took half a gram of curcumin, and some didn't. They found that those who took curcumin showed significant improvement and better results in their arthritis. The group with diabetes, metabolic syndrome, which is related to obesity and weight gain, high blood pressure, low LDL cholesterol, high LDL cholesterol, high triglycerides, and visceral fat, the fat under the abdomen, were all found to benefit from curcumin. Curcumin improved insulin sensitivity and lowered high blood pressure. They also studied 34 Alzheimer's patients and found that curcumin improved disease progression, cognitive function, and vital signs. There's much more to this research on curcumin. This is a comprehensive study focusing on these 4 areas. Peace, mercy, and blessings of God be upon you. And upon you. Diaf or Kulthum Diaf. Welcome. Of God. Where are you from? Tell us where you're from. And why are you up so early? Chickens contain hormones. Yes, they do. Chickens contain. That's our problem with chickens, so there needs to be oversight of this issue, the hormone levels, because a hen is a chick, and within 3 weeks it's to ready. Eat. There needs to be oversight of these hormones. I mean, to assure people that they're 3-week-old chicks, we put in hormones that are very harmful to health, very harmful to health. In some countries, people love chicken, like the Gulf countries. God grant them health. They've lived on chicken their whole lives. They always buy all bake, all Dosage, and kabsa. Chicken dishes are delicious there. We should go and perform Hajj. We're doing Umrah, so we have to get this all bake. Doctor, why is my blood sugar high in the morning? So what's the problem? At 7 a.m., your body releases a surge of cortisol to help you wake up. Okay, you wake up in the morning and focus. If you're a normal person, you wake up in the morning, focus, and feel ready for work. And the cortisol released at 7 a.m. is called diabetic. That means it's not just cortisol, there's also growth hormone. It's true that growth hormone decreases after age 50. It's released in a surge. These hormones are released in the morning to prepare you for work. And God made the day for livelihood. These things are released, my friend. Growth hormone raises making the liver pump level. All the sugar it has. Cortisol also pumps sugar, so these hormones released in the morning raise blood sugar levels. So in the morning, you check your fasting blood sugar and decide what to eat for breakfast. Your medication dosage accordingly. Now, let's talk about your situation. What other research? We're getting serious for a bit. We haven't really gotten into just the 4 herbs stuff yet. So, what does it say? I'll tell you the translation now. It says, does the key to relieving anxiety lie in the gut? For people with anxiety, stress, and depression, scientists from Duke University in the US. Okay. I mean, at Duke, NUS Medical School, Duke in America, right? And the National Institute of Neurological Sciences, a group focused on this neurological issue, wanted to find something natural too. And this is a huge problem. Nerve medications are a problem, right? They found a close relationship between gut microbes and behaviors associated with anxiety and stress. Of course, when we come to our hot country in the summer, we see intestinal upset, so we buy Flagyl, Antanol, and Streptokin, antiseptics that kill all the microbes. Then you see all the benefits that come from them, and we've talked about them many times before. They published it in a major journal called EMBO Molecular Medicine, indicating that the metabolic byproducts of microbes, billions and trillions of beneficial microbes living inside your gut, eat with you and produce beneficial substances. Amazing. They produce something called indoles. Okay, indoles, I'm a chemistry expert, so I know about them. These indoles, when we want to create a compound that goes to the brain and acts, for example, as an antidepressant, they're naturally present in the hormone melatonin, which helps you sleep naturally and wake up refreshed. They're also present in a neurotransmitter called serotonin, the happiness neurotransmitter. All antidepressants increase serotonin levels if someone is depressed. So, imagine that the bacteria living inside your gut are naturally producing indoles. Okay, so someone might be happy and the world's big problems aren't affecting them at all. Do you know that their microbes contain indoles? His gut is healthy. He hasn't taken antibiotics in a long time, and you want him to get depressed and go back to being like you. What do? Give him a dose of antibiotics to kill those microbes, and then he'll be upset. They found that it plays a direct role in regulating brain activity related to anxiety. So, what do you think? You might find a psychiatrist prescribing anxiety medication for a patient who can't sleep, restless and upset, is about to take exams, or is facing a big problem. They might prescribe probiotics, or tell him to eat a box of yogurt every morning. They say 1 in 7 people this research was done. In Singapore, 1 in 7 Singaporeans, even though they are very rich, here Singapore is richer than America, yet 1 in 7 of them has a mental disorder, the most important of which are depression and anxiety. So, these mental health disorders are among the 4 main causes of the disease burden in Singapore. May God heal them. Singaporeans are cured. An in-depth study revealed that increased anxiety is linked to increased activity in a brain region responsible for processing emotions, namely fear and anxiety, called the lateral basal amygdala. Okay, has a difficult English name, so when this lateral basal amygdala is activated, you become anxious and tense. So, what did their results say? So, microbes are related to mental health. People who don't have live microbes, who are on antibiotics and intestinal disinfectants, and who have been taking all that stuff, have higher levels of anxiety compared to those who have live bacteria. In short, the absence of these microbes disrupts the way their brains work, especially in the areas that control fear and anxiety, leading to anxious behavior. So, what's the deal? After sending hunger signals and controlling a defense mechanism that's pre-programmed, God created it. Let's not use that evolution thing when you're hungry. Signals go to your brain that activate anxiety. You want to eat, you go into the house starving, you find the food isn't ready, and instead of preparing food, the woman in the house makes problems and all sorts of things, so you argue. Why did you argue? Because you're stressed and hungry. We're all like anyway. That. And the way to a man is through his stomach, you know. So, what's the deal? So, he's telling you that at birth, it's like a big first wave of exposure. The important thing is that when babies get hungry, the infant will cry immediately because he wants to eat. So, what does that mean? In addition, birth is linked to exposure to breast milk, which is known to contain microbes capable of producing molecules called indoles. So, one of the things that calms the baby is that breast milk itself contains these beneficial microbes that cause the baby to produce indoles and start to calm him. There are plants that secrete indoles when exposed to stress or malnutrition, and these are given to him. Anyway, there's a lot more to say. Okay, it reflects sensitivity. Anyway, there's a lot more to say because this research suggests that microbes have a role in treating depression. Now, let's get to an important study. All the diabetic patients gather here, and whoever enters our broadcast later start focusing. Because the topic of diabetes is very, very important. So, what does it say? A comparison between oral medications and insulin means people who take insulin along with other medications, not just insulin alone, and want to stop taking insulin. They tried something with them that was very successful, triple therapy. So, what did their study aim to do? To compare the effectiveness of adding insulin to two medications in lowering blood sugar. They took patients who were taking two medications, one called sitagliptin and the other metformin. And they were also taking insulin. They were following this regimen perfectly. You take two medications and supplement, or you take insulin and manage your blood sugar with both medications. Diabetic patient might hear us and say, I'll only take insulin, but that's completely wrong. These people are taking two medications. Metformin is essential. No one is exempt. Don't take those who are free to do so. Metformin with sitagliptin is one of the medications that regulates insulin in the body, helps reduce appetite, and helps with the issue of fat accumulation. There are many important things along with insulin. Now, in contrast, there are people who are given 3 medications without insulin. These are the same medications, sitagliptin and metformin, and they are also given a medication that increases glucose in the urine, such as clofazimine Forxiga, and there are many alternatives, like Jardiance. These are the newer medications that increase glucose in the urine. So, you either take insulin along medications, or you take all three medications without insulin. Okay, so how long did this study last? It started in Peshawar, Pakistan, at a very large hospital, from September 21st Street to December 21st, 2023, that's 3 months. You take the 2 medications and insulin, and you take the 3 medications without insulin. The patients were divided into these 2 groups. And these people were their blood sugar is messed up, meaning both of them are unwell. Their hemoglobin HbA1c was above 7. Anyone listening now who has meaning it's not under control. So, the group that took 3 medications, a drug called the gliptin family, metformin, and gliflozin. These are the best doctors, and the smart ones should write this down. The other people took gliptin, metformin, and mixed 30/70ths insulin. So, their blood sugar is now under control. The study included 80 patients and lasted 3 months. They measured their HbA1c levels. Researchers, so what did they find? They found a very pleasant surprise. The group that didn't take insulin and followed the triple therapy had much better results in controlling their blood sugar. Yes, much better than those who were onto medications with insulin. They say that the triple therapy regimen improved their body mass index, their bodies started to lose weight, their cholesterol levels improved, their bad cholesterol decreased, and episodes of hypoglycemia disappeared because, unlike others, these episodes were caused by insulin. Sometimes their blood sugar would drop, they'd experience a drop, and they'd have to seek treatment. But these are oral medications that never lower blood sugar to a level below 70 or anything like that. So, these were more effective than the dual therapy regimen, which involves taking to diabetes medications with insulin. My advice to these people is to talk to their doctor about getting this triple therapy regimen. What does this triple therapy consist of? As I mentioned, you'll find gliflozin with metformin, or gliptin with metformin. These 3 medications end with gliflozin, gliptin ends with gliptin, and metformin, which is glucophage if taken alone. These are better than taking 2 medications with metformin. About those who insulin, only take insulin, what? Meaning they don't take any oral medications at all. That's a real problem for them. May God protect them, you might say, but then insulin is bad. I'd say no. Insulin shouldn't be taken alone. Actually, there are other patients who might take this triple therapy and still have slightly elevated blood sugar. These patients then need 5 units, or 10, the doctor said something, so it's very important. Guys, diabetics always listen to me a lot because they go to doctors a lot and get tired and want to understand how their treatments work. Please, the most important thing is to focus on combating aging. Most of my videos are about this topic, based on research. Because no one should but be careful. Aging is going to be solved and cured. No, we're going to die anyway. Okay, but the process means improvement, not elimination. It's not about eradicating aging. About anti-aging. No, of course there's no such thing as a final cure. No, of course not. It's about whether someone who promotes and incites the Dubai system is complicit in the murder of a patient who suffered retinal complications. I swear, I deliberately don't look at this system or know anything about it because I care about information based on research. This guy made this system up. I have no say in this. It has to be based on research. Why haven't you published it? You could have easily. divided the patients who come to your clinic into two groups. Those who take your treatment and those who refuse it. Or, you could have followed up with each group, taken their results and measurements at their expense. And done the research. You could have told them to get tested, and they would. You could have told them to take measurements, and they would. So, there's no. Then, others around the world would believe you. Your results, try them, and ask if your claims are true. But instead, you say, my from the Curcumin, and then you start attributing things to the Curcumin, trying to cling to it. The Curcumin is clear to people. And religious scholars are obligated to interpret it better than you. And then, the best proof is himself. I thought this doctor was in his 50s. He used to say, especially towards the end of my life, I'm over 50. I thought he was 57 or 58. I found him in his mid-40s, a heavy smoker, and he's depriving himself. He's depriving himself of water. Saying things like, what's wrong with you? What's wrong with you? What's wrong with you? Well, you died early. You had a stroke, fine, so you aged early. I even saw him. I told you in a previous episode. I saw 2 episodes of one with a year's difference. He aged terribly. There are groups who don't take anything except from scientific sources and ignore those who tell you, I tried it. I tried it and it worked for me. Okay, some things work based on illusions. When I was little, I used to get sick. Always had chest problems. When I was in my first year of high school, I'd cough and get sick. To get bronchitis. My mother couldn't bear it. As soon as I coughed, had phlegm, a fever, and all that, I'd run to the doctor, sick. The doctor would do an x-ray and prescribe cough medicine, a mixture, a strange concoction for coughs. Back then, there weren't. And then there was the treatment, like that. And all that stuff. I'm going to the doctor sick, going. I was sick, feverish, and had a severe case of bronchitis. Did the x-rays and scans, saw the black. Prescribed the 4 solution, and I went to the pharmacy to get it. I felt better. I told my mother, may God have mercy on her, I'm feeling better, Mom. She said, my son, we got the medicine. Imagine that. The placebo effect. They call it the placebo effect. You just went to your doctor, and you might feel better on that system. Without anything else, God knows best. I always say, as long as something isn't scientifically proven, God knows best. We don't say yes or no. You just want to try it. The person who used it harmed himself. He harmed himself. He died of a stroke at such a young age. His health definitely wasn't good. His brother. His brother is alive. Take it, don't take it from us. Listen, sir, take it. There will be research on this, now. He's talking about this topic, about people who care about their health. Anyway, I'll tell you the details in a bit. It's something interesting, a rather scary piece of research. So, this is regarding anxiety, exposure, microbes, and things like that. Now, let's talk about insulin. Sorry, last thing. There's a piece of research I want to tell you about. This is research published in Nature. Something really interesting. It's research about aging and treating aging. I'm not going to go into the whole research, but it talks about things that treat it. Listen to what the speaker says. He talks about aging, about the causes of aging, and all that, and what can counteract aging. Just listen to the end. He says aerobic exercise, sports, and all that. Then he says fasting, which is dietary restriction, meaning people fast, reduce their food intake, and so on. And he talks about medications that mimic. Fasting means you can't fast or reduce your food intake. There are medications that help with this and have a very good effect, including, of course, glucophage, metformin. We also talked about acarbose. Remember, acarbose is a diabetes medication that prevents the absorption of sugar from the intestines. He spoke about it from experience and gave very good advice about it. Then, He said something that I've never heard before. He said that the good effect of anti-aging medications is beneficial for older people. Listen carefully, this effect is helpful when you're young. What does that mean? I'm young, I'm in my 20s and 30s. Should I take anti-aging medication or do sports that will benefit me in my old age? They said, yes, but what if I'm older, a man over 60 or 70, and I'm neglecting my health? Should I start taking anti-aging medication, start exercising, running, fasting, and so on? They said, these have harmful effects. If I could just point out something, they'd tell you that fasting, metformin, and physical exercise are fine, but medications and things that accelerate aging are bad for older people. Decrease lifespan and decrease health span. What does that mean? It means they're harmful for older people. So, if you're over 60 or 70, these things won't work for you. It's strange. I'll make a whole episode about this research because it's really odd. These things. But if you've started exercising early, started metformin early, it doesn't work. Your health, increase your lifespan, and all that. So, he's showing you a diagram summarizing the main interventions that promote healthy longevity through various means, like metabolism. He says it's preferable to take these things at a young age, as they act as stimulants for the functional flexibility necessary for healthy aging. They stimulate cell remodeling, and so on. However, at an advanced age, the effect of these things is minimal, very minimal, on health. So, they've brought in animals and are experimenting on them. When they start these things at a young age, they get much better results than when they start at a later age. This is new information. I've never heard of it before, but this. So, what should they do? He's asking. For older people, what should we do? You're making us depressed, man. May God punish you. So, we shouldn't start taking anything at all. He's saying ... Well, since some of the most effective life extension treatments lose their effectiveness with age, meaning these effective medications lose their potency with age, it becomes necessary to address the challenge of updating interventions and the discourse. Okay, tell me, sir. I'm keeping quiet because he's using jargon and things that are unfamiliar and upsetting to the viewer. If they heard him, they wouldn't understand him at all. And medications, of course, medications. Basis in Islamic law, it's completely unacceptable for people to take them. We need either nutritional supplements or something with a known safety profile, he says. Older people should take something to boost their blood sugar. What does boost mean? That's what will be beneficial for them. What are blood sugar boosters? Vitamin B3, niacinamide, which is available in pharmacies. Niacin, which causes flushing and redness. The face, okay, so you can take it or not. The dosage of act is 250 mg. Niacinamide can be taken in half a gram or a gram. It doesn't cause flushing, it's better. There's also NMN, it's a dietary supplement available online. NMN capsules, NMN, all of these improve the NAD, and the NAD is very important. Okay, I'm talking about NMN, finally giving us hope. Okay, and there's one called NR, which is nicotinamide, also a dietary supplement. NR, all of these are the same, of course. Something cheap for those in Egypt who want. If you can't find it, get niacin. If you can't find B3, the cheapest thing. Vitamin B3 is cheaper than all of them. Then there's one called rapamycin. It's not suitable for us at all, so this is a solution for adults. Okay. Thank God we found something for adults. But, of course, guys, I don't believe this guy. Many studies have said the same thing. It works at any age. but its effect will decrease. Because it's more advanced in age than 80. Giving these things to someone over 80 will make them look like they're 20 or 30 years old. You'll see some effect, but it diminishes over time. This is perfectly normal. Imagine who's 100 years old and you start giving them these things. Well, you've lived 100 years, you're perfectly fine. But if you start early, the effects of the use itself will begin to show. For example, if you use omega-3 for 10 years, it's better than using it for 3 years. Or for 1 year, or not using it at all. The logical approach is this way, not telling them, you're too old, don't take any medication or anti-aging products anymore. You should just sit around. That's not right. There's also the issue of heart health and diabetes. There's a lot of research on diabetes. I really want to talk about diabetes. I mean, the topic of oxidative stress and what medications are involved is really important, and it's the first time I've heard about it. We always tell people with diabetes to use herbs alongside. Those are the ones with antioxidants. We tell them to take cinnamon, turmeric, ginger, and so on. But this research asks if there are diabetes medications that also act as antioxidants. It says yes, there are 3 types of medications with antioxidant properties. The first type is metformin. Okay, metformin glucophage. We'll bore you with that one a long time, and you might find that medication isn't glucophage, for example. No, you're prescribed. What do you mean by plus? Like for example, if it says digliflozin plus, and you look at the active ingredient, it might say dapagliflozin 5 mg plus 1000 metformin, or maybe it's Gal's 5/50ths, 1050. What's it called? It's one of those gliptins. And the 1000 is metformin. So you're taking 1000 metformin, and the maximum dose is 2000. You're taking metformin without even realizing it. Don't take it. Metformin has antioxidant properties. I've seen a lot of research showing it protects the heart, reduces liver fat and cirrhosis, and also helps with diabetes treatment. So what else? GLP-1 injections. GLP-1 injections are similar to insulin injections. You'll find them in a pen-like container. Insulin, but it's not really insulin. Which is given as a daily injection of 0.6 or 1.2. It's called a weight loss injection. There's Saxenda. And there's another one, the very famous one from Mounjaro, which is the most expensive of them all. There's also one called Ozempic. So, these diabetes and weight loss medications were originally diabetes drugs that were found to have antioxidant properties. This is according to the research. It's the first time I've encountered this. Glucosine family, which was also found to have antioxidant properties, which glucosine family lowers sugar in the urine. It's the Versiga family. Okay. The Januvia family, the one that lowers sugar, is empagliflozin and dapagliflozin. All of these are antioxidants. Okay, everyone, does anyone have any questions? Let's start today's work. Hello, doctor, please go ahead. I'm live. Good morning. Go ahead. Yes, I'm live. I'm almost done. Okay. I'll end the broadcast and just answer some questions from people, if there are any questions. Is it true that someone died in Dubai? Yes, they banned diabetes medication after scientific and clinical confirmation that metformin is harmful to young people. There are 1,000 medical studies on metformin. I can get you 2,000 studies from multiple sources. Have been taking it for 12 or 13 years and I'm doing fine. So, they're banning diabetes medication. Once in a small place say, if your blood sugar reaches 1,000 double quotes by 600, the blood glucose I haven't read anything, reading is, and if your blood sugar is 1,000, take it, you won't don't survive. Take the medication. Don't. How is that possible? This is premeditated murder. Someone with that high blood sugar is telling you that this will help with diabetes. There is no God but God. May God forgive him for what he said. About young people, diabetics should take metformin and advanced medications. With age, taking Preparin is because Preparin is a natural substance and doesn't have any. They say it's equivalent to metformin in strength. I haven't tried it myself, to be honest, and I haven't gotten metformin. Now, guys, very important news. Very, very good news. The image I told you about 2 years ago in a video shows that this is a new treatment, an alternative to glucophage and stronger than glucophage. The Japanese treatment that was available in India and Bangladesh has now been released in Egypt. There's a drug in Egypt with the same name as the one I mentioned in the episode. It's now available in Egypt and online, so anyone who wants it can look it up or ask their doctor to prescribe it. We've given the company free advertising, which is great. They've even considered Preparin for older people to try. I don't see any other questions. We have a lot of research, but we've been robbed. It's time for our work. It's 1:15 here, so we have to start working on the episode. If you have any other questions, write them in the comments. God willing, goodbye, and peace and God's mercy and blessings be upon you.